Today, I'm Princess Mariel J. Jumlani, and I'm going to demonstrate the physical assessment and how to perform it. First, in taking the health history, start your assessment by taking a detailed history to obtain subjective data. The information you gathered during the interview provide insight into the patient's actual or potential health problems and guide your physical assessment. So, while the patient is changing her gown, first thing to do in physical assessment, we need to wash our hands, and also the equipment needed for physical assessment, which is gloves, stethoscope, thermometer, pen light, otoscope, and BP apparatus. To make the patient feel comfortable and respected, begin the open-end question requires yes or no answer. In physical assessment, we need to apply the basic technique, which is the inspection, palpation, percussion, and auscultation. So, we're going to ask the patient if there are some questions. So, hi ma'am, do you smoke?
No.
Okay. Note, also note that the question level or consciousness, the patient level of consciousness, including his degree of wakefulness and orientation to person, place, and time. So first, we need to take the patient vital sign. We use the thermometer. And also, we're going to check her peripheral pulse, which is part in the radial. Taking this in 1 full minute.
Pinasan.
Also, taking her blood pressure. We're going to assess the patient's head and face. Inspect the head and face. They should be normal in size and shape, symmetry, and contour. Look at the patient hair and note its distribution, quantity, and texture and color. The hair should be symmetry, dry, or oil, and should not contain scales or nits. Next, palpate the patient's scalp, which should be pink, mobile, and free of lesion. You may feel bony prominence in the forehead. In the side of the parietal bone and behind the ear, the normal. Of your middle and index finger, palpate the temporal arteries. Their palpation should feel equal. Next, listen for the bruising over the temporal arteries. Should not Here, any. Next, pressure thumb under the inner aspect of the orbit to palpate the frontal sinuses and press under the zygomatic bones to palpate the maxillary sinuses. Then lightly percuss these areas, palpating the percussion and sinus should not cause pain or tender if they do assess the sinus further with transillumination. Move your finger to the patient temporomandibular joint as you palpate with your finger. Instruct the patient to open to test the facial muscles and motor portion of the facial and trigeminal nerves. Have the patient raise her lower his eyebrow, bare his teeth, smile broadly, pop up his cheek, and keep the patient close his mouth and try to open. All the movements should be symmetrical. Open. If the patient reported problem with his sense of taste during the health history, interview the test and sensor portion of the facial nerve by having the identity sweet, sour, bitter, and salty substances. Salt to assess the sensory portion of the trigeminal nerve. Patient ability to identify simple touch. Instruct him to close his eyes and to tell you the moment he feels something touching his skin, cheeks, or simple touch sensation both side of the patient forehead, cheeks, and jaw. The patient should feel sensation to identify simple touch. Instruct the patient close his eyes. And to tell you the moment he feels something touching his skin, cheeks, or simple touch sensation and jaw. The patient should feel sensation equal on the either side of his
Left head, right cheek, right cheek.